Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. Most enrollees in the marketplaces created by the Affordable Care Act are eligible for subsidies that reduce their premium costs, often quite substantially. In an effort to make it easier for enrollees to prove their income and obtain the subsidy for which they're eligible, the marketplace can use data the government already has, such as tax data, but it can only do so when the enrollee gives permission for them to do it. Not surprisingly, not and all enrollees do. So, is it possible to encourage enrollees to provide this permission, which can be worth hundreds of dollars in monthly premium cost reductions? That's the topic of today's episode of a Health Podyssey. I'm here with Andrew Feher, a researcher in the California Department of Healthcare Access and Information. Feher and co-author Rebecca Meyerson published a paper in the September 2024 issue of Health Affairs that reported the results of an experiment using email messages to encourage eligibility verification and subsidy receipt in Covered California, which is California's ACA marketplace. We'll discuss the results of that experiment on today's episode. Dr. Feher, welcome to the program.
Thanks very much for having me.
So I think it would be helpful if you could provide our listeners with a little bit of the policy context of your study. I gave the very quick thumbnail in the introduction, but how does eligibility for premium subsidies work in California? Why do you need consent? Can you just sort of explain the context that led to the experiment that you conducted?
Sure. Yeah, it's a great question. And so I think some listeners may be aware, but so the ACA or the Affordable Care Act set up premium subsidies to be income-based, where more generous subsidies go to lower income enrollees. And when applying for health insurance coverage, there are two ways you could sort of do so. There's a subsidized application pathway and an unsubsidized application pathway. Just about everybody will follow that subsidized application pathway to express interest in being determined for whether or not they'll receive a non-zero amount of subsidies. And so when you're applying for these subsidies, consumers have to answer a litany of questions about there's various sources of income. So if you go through an application, it's upwards of 6 pages of income and related questions to really get an understanding of a household's income circumstances. But it's all consumer attested, and so it falls to the exchange to really verify a lot of that information with, as you noted, federal data sources like the IRS. And so what's quite important in this context is under current federal regulations, exchanges are only able to obtain that consent from consumers to obtain tax information for a maximum of 5 years. And so in Cover California, on the application, we'll set the default at 5 years just to kind of set that upper ceiling to minimize those frictions. But there is this sort of obscure and relatively minor task of consumers having to update that consent periodically that can actually lead to eligible enrollees losing those subsidies if it sort of falls through the cracks and they don't realize, because 5 years have passed. We do a lot of things today that we may not necessarily remember 5 years from now. And so you get that sticker shock come renewal of that following coverage year of going from a $50 a month premium to a $500 a month premium. So it is quite a dramatic sort of change of circumstances for a lot of these consumers. And in the Cover California context, depending on the year, it could be anywhere from 30 to 40,000 households who find themselves in this circumstance where their consent for verification does expire.
So in the way that we can only do in our government programs that are oriented to people with low and moderate income, we ask them to prove how much they have. And we've created this, what might seem like small administrative hurdle that becomes a barrier, as you say, for tens of thousands of people. So what is it that you set out to figure out here? You're trying to get people, after these 5 years are up, to renew their consent. What was the intervention you tested?
For background, for the years leading up to 2020, the sort of standard protocol or the status quo approach, for those with emails, the organization Cover California would send an email notification saying, hey, your consent's expired. Please take action as soon as possible to ensure we're able to verify your information heading into renewal, and you'll be able to have, if you're eligible, subsidies applied to your gross premium to reduce that cost. And then for those without emails, they would get a letter in the mail. And so leading up to the renewal period for 2020 in August, we queried our Cover California administrative database and identified just under 23,000 households who had applied for the subsidized subsidized application pathway. So indicating they were very much interested in getting subsidies if they were not already getting subsidies. They had an email address on file, and their consent for verification was set to expire at the end of 2020. And so what we ended up doing is we knew what the status quo was. We sort of had a pretty good indication of what the outcomes at the end of open enrollment look like for those households in terms of kind of overall consent update rates. But what we did was set up an experiment where we randomized these households to one of three groups. So we maintained the status quo of sending a single email reminder in September, but then we also added two other arms. So a second email reminder later in the month of September, and then finally another group received a third email reminder through the middle of the month of September. And so that then allowed us to see sort of at baseline, what would consent updates look like? And then what was sort of the value add to the organization of sending these additional email reminders to households in the lead up to sort of renewals for the 2020 coverage year.
So you're trying to figure out whether sending people an email will get them to do something that could potentially save them hundreds of dollars a month. What'd you find?
That's a great question. So we examined consent updates through a couple of different time periods. So the most immediate and pressing timeline is to get them through a call to action deadline of September 30th. And so renewals are typically set to start in October. And so if we don't have your updated consent heading into that October period, we won't be able to verify your income information heading into renewals, and you're going to get that sticker shock when your initial sort of premium statement is generated for the following January. And so we looked at consent updates through the end of September, and then we also looked at them through the end of open enrollment in January. And so by the end of September, only about 13% of that status quo arm, that one email arm group, had updated their consent, and randomizing households to 3 emails increased consent updates by just under 6 percentage points, so about a 40% increase. And so that is great because you're getting people to take action earlier, which avoids that sort of unfavorable outcome wherein they're going to see their gross premium instead of that sort of subsidy reduced premium on their first statement for the new coverage year. And then when we looked outwards towards the end of January, so the end of open enrollment, where you would expect people to want to have a full year's worth of subsidies applied to their enrollment, the effects do diminish. So by the end of open enrollment, we see that status quo group, that one email arm, about 60% of households had updated their consent. So it substantially increased. And then the assignment to those 3 email reminders increased consent by just under 2 percentage points. So about a 3% increase by the end of open enrollment.
So let me just make sure I'm understanding this. What you're trying to get people to do is to update their consent. And actually, the emails seem to have quite a significant effect in getting people to do it early. But what you're finding is that just time and maybe the realization that this is a problem actually gets a fairly large number of people later on to update their consent, whether they've gotten the reminder or not. The reminder still has some effect, but it's really dominated, I should say, I guess is the right word, is dominated by the fact that the passage of time and the press of events makes more people in all of your categories, the control group and the treatment groups, more likely to provide consent. Is that a fair interpretation?
That's exactly right. So there are a number of circumstances that can transpire between October and January. So what we would often see on social media, there would be Twitter posts tagging Cover California saying, hey, what happened? I was paying, like I said, $50 a month, and now all of a sudden I'm paying $500. And so our social media team would often take a fair bit of time to just respond to those folks and to better understand what their case circumstances was. And in many instances, it was this issue of consent for verification. And so sort of piecemeal, gradual efforts through social media outreach to really help some of these consumers understand these administrative tasks that they needed to complete. So time does help, but it doesn't necessarily address or resolve the sort of psychological stress that comes with that kind of substantial premium increase that you weren't necessarily expecting.
Right. I mean, you could imagine some people just abandoning at that point, going, I can't afford this. You can also, although the effects diminish, there still are some. So it does seem like it does make a difference, even though these other events may take place. And just to round out sort of the intervention side of the discussion, was this a hard thing to do, expensive thing to do?
So one of the nice things about emails and their deployment is they are very cost effective for an agency. That's not to say we should sort of single-mindedly rely on them, because there are going to be tasks where an email is probably not going to address the friction that a consumer is experiencing, whether it's related to their application or their enrollment. But in this particular case, we thought if we can develop a clear communication via email and deploy it for the cost of about a cent per send, it was a pretty cost-effective way to message those consumers in this subpopulation. And so at the end of the day, just given the low cost of the intervention and the treatment effect we observed, costs about 50 cents to the organization per additional consent update as a result of those email reminders. So a pretty good bang for our buck. Obviously, we're not a for-profit as a government agency, but we don't want to spend taxpayer dollars unsoundly. And so this was a pretty good use of resources for the organization.
So these seem like pretty promising results. I want to talk to you about sort of where we go from here, how we put these in the context of other initiatives that you've tried or might want to try. We'll cover those topics after we take a short break. And we're back. I'm speaking with Dr. Andrew Feher about the effect of email notifications to people to remind them that they have to give consent in order for the California ACA marketplace to confirm their eligibility for subsidies that could be worth hundreds of dollars a month. Before the break, we've covered sort of the major findings. This is a relatively straightforward intervention. It seems to have quite dramatic, I would say, short-term effects. Over time, they're offset a bit by, or diminished a bit, I'd say, by other intervening factors, particularly people realizing that if they didn't give consent, they might be facing much higher costs. So it seems like a good thing to do, but as you noted when you reviewed the data, even after this intervention and even after the passage of time up until January, you still have a large number of people who don't provide consent. Do you have any sense of what happened to them, where they went, or did they retain coverage at a higher cost? What do we know about them?
It's a great question. And so, yeah, as you noted, if at the end of open enrollment, only about 60% of households updated consent, that leaves about 40% of their households that never actually took that action to update their consent. And so we tried to dig in to the extent the administrative data permitted to understand where these folks may have gone. And so when we looked at sort of the extent to which somebody moved out of state, or the extent to which somebody was eventually found eligible for Medicaid, those tended to be pretty small shares of the population. So no more than about 10% of the population either left the state and thus probably had no reason to update their consent, or ventured off to Medicaid, and also didn't have reason then to worry about this administrative task. So that then means there was a pretty substantial portion of remaining households who remained enrolled without having updated their consent. And so as a result, they were needlessly paying full price for their marketplace coverage for that 2021 coverage year, which can really place a considerable strain on household finances, particularly for those lower income enrollees.
It's sort of I don't know any word to say other than it's sort of sad. I mean, I completely understand that we don't want to be pulling people's data without their permission. Whether 5 years is the right amount of time for someone to be able to give consent, I couldn't answer that. But the notion that people who we know have moderate incomes are just leaving behind subsidies that would be available to them seems disappointing. Of course, we also know that in all programs, there's under-enrollment, so maybe we just sort of think of it along those lines. Let's broaden the lens a bit. So this is an experiment of a very specific intervention, very helpful to have that level of specificity so we know something about it. Are there different strategies that you have tried, that you'd like to try, that might help you reach some of those 40%? Or, well, let me start there, because I'm also interested in whether we could just make some of this problem go away. But what else might we try?
It's a great question, and I think internally, the results of this intervention spawned a number of conversations about that very sort of what seemingly is an arbitrary 5-year deadline, given that lots of consumers who may be self-employed or otherwise just rely on the individual market for coverage shouldn't necessarily be subject to this kind of recurring administrative task. And so, as part, sort of what emerged from, I think, those internal conversations was just informing CMS, the Centers for Medicare and Medicaid Services, that this should really be an opt-out process. So if consumers have gone through the effort to say, here's page after page of my income information, there should be sort of a presumptive consent there. I would like for you to very much investigate to the fullest extent possible whether or not I'm going to be getting subsidies. And so Cover California did ask CMS to allow exchanges like Cover California to just really flexibly obtain consumer information for tax purposes to evaluate eligibility for subsidies. But federal regulations still remain on the books in the same format they were in 2020. And so Cover California is going to be governed by those until anything changes. But that, I think, based on other work we've done, typically sort of slightly paternalistic, but sort of trying to automatically facilitate some of these barriers for consumers, it tends to be far more effective than these kinds of low-cost nudges that rely on email outreach. And so in a perfect world, I think Cover California would very much like to move to that kind of presumptive consent framework. I just don't think we're there given where the federal regulations currently stand.
And given that you've brainstormed on this, although I like the idea of relieving the burden, are there other outreach? I mean, you mentioned you have to have an email address for these folks. You send by mail. We all know that can be a cumbersome method. Are there phone calls, other strategies, or is this kind of what you got?
Yeah, no. So this was a helpful intervention insofar as beyond the initial enrollment and eligibility outcomes, we did also look at kind of operational outcomes. I think what's always top of mind for us is the extent to which what we think is sort of a net positive may have downstream consequences for other operational teams at the organization. And encouragingly, the email addresses in this particular case, or the email reminders, I should say, didn't necessarily increase service center call volumes, which is always kind of top of mind because you don't want to unwittingly kind of burden another operational team if they weren't aware of what's going on. And because we found that there wasn't any sort of adverse impact to the service center, that could be a promising avenue. It's not as scalable, of course, as being able to fire off 20,000 emails overnight. But we have found in other work that personalized outreach from an expert call center representative can really help consumers overcome either application or enrollment frictions during open enrollment.
Yeah, that makes sense. I mean, there is good data on the kind of hands-on assistance many people need. And maybe we think of providing consent as not the kind of thing you would typically need the hands-on support for. It doesn't seem like it would be that complicated. But if you have questions about it, you need someone to ask, and someone's got to answer them. And just having an email that says "do it" might leave someone wondering if they need to. Well, as we bring our conversation to a close, I want to ask you about something much broader. I hope it's okay. We've published a number of papers in Health Affairs that have come out of experiments related to Covered California, the marketplace. And I will say that I can't, in my mind, think of other exchanges in other states or the federal exchange that have conducted these kinds of experiments. It may seem small scale to someone from the outside. This is just a bunch of emails. But structuring an experiment, thinking of who's your sample and how do you divide people into different categories and compare their characteristics to be sure that you're really able to isolate treatment effects, that's a big undertaking. And yet it provides us with what is often considered to be the gold standard of evidence. So much of what we publish in Health Affairs and so much of health services research is based on methods that are designed to approximate experiments. You actually did one. So I wonder if you could just say a little about the culture of Covered California that leads to this notion that we're not just going to do stuff we think works. We're actually going to create experiments around the things that we think might work and answer the question of whether they do or not, as opposed to just throw a bunch of stuff out and think in our head, well, this has got to be the right thing to do.
Yeah, it's a great question, and I think you sort of began to tease out some of the dynamic that occurs internally, which is we're sort of quite humble at times about we may have some priors about the best course of a policy action or how to design a new program. But there's often quite a bit of uncertainty associated with potential unintended consequences, or does the policy or program have its intended effects? And I think what's really exciting about a place like Cover California is there's a commitment to this continuous improvement. We may think, in 2015 we made a great decision, but we necessarily may not have had complete information. And so wanting to revisit that, paired with what I think is a really foundational understanding about the importance of research design, right? So to your point, I'm sure there are plenty of organizations that are eager to collect data and try to make sense of it. But there's really no substitute for having credible research designs. And one of the nice things about experiments is they're often quite easy to understand for policymakers, regardless of whether or not they've got a background in causal inference or experimental design. Comparing two sample averages is relatively straightforward. And so you don't necessarily need to get into the weedy details of sort of the underlying assumptions of more complex empirical methods. And so I think that's kind of the basic framework, right? We don't necessarily always know if we've adopted the right policy, coupled with just really actually wanting to understand the effects of some of these programs. And then I think what further kind of creates this culture is just an integration of research staff with operational teams. And so at any given point in the year, when I worked at Cover California, I may be embedded in a marketing team, or I may be embedded with a service center team, or an eligibility team to really try to understand opportunities for evaluations. It's not always going to be possible due to either sort of timeline constraints or resource constraints, but whenever possible, we would really want to make sure that the research and evaluation units were really embedded or integrated with folks that may not necessarily have the time or the bandwidth to think about how would we evaluate this change at renewal or open enrollment or special enrollment. And so I think that combination really fostered a great deal of collaboration and pretty frequent experimentation throughout the year.
That's so interesting. I'm sort of stuck on something you said a moment ago. I'm trying to absorb it. This notion that in some sense, results of experiments are actually easier to describe and explain to policymakers. And it's so true. I mean, when I think about the papers that we publish where we're not going to go deep into this in this conversation, but, where you've got some sort of, again, you're approximating an experiment. So you have to do lots of data manipulation to show why these results are robust. And the methods may be perfectly legitimate and fully validated, but the interpretation of results is often very complex. And what you're saying to me here is, it's really easy to look at the results here and understand what the effects were. And that's one of the benefits. I just never thought of it that way, so I appreciate that. But I'm also really drawn, sorry, I did get a little stuck on that. I'm really drawn to the notion that the research teams are embedded in operational teams. That's such a critical dimension of allowing you to be involved from the beginning and to learn where there are opportunities for experimentation that wouldn't be possible if you were just sitting looking at large databases or survey results. You're actually out there at the front, and that sounds like a productive but also a more interesting role to play than many on the research side do. Well, Dr. Feher, thank you for doing this work and for explaining it with such clarity and giving me some encouragement about the possibility of improving our knowledge by practices that make sure that research really is embedded into the work of Cover California, something that I knew but had never understood quite the same way. Thank you for being my guest today on Health Podyssey. Thanks very much for having me. Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about a Health Podyssey.